In this video, we will review the emergence and extubation process. As the surgeon is finishing up the procedure, administer antiemetics and have a post-operative pain management plan in place. Verify the surgeon has completed the surgery. Fascia is closed and he or she is beginning to close skin. Change the ventilator settings to synchronized intermittent ventilation, pressure control, or volume control to allow the patient to take their own breaths when ready. Decrease respirations or tidal volume to build up end-tidal CO2. Once the patient is breathing on their own, switch the ventilator to pressure support ventilation and assist his or her ventilation. At this time, check train of 4. Make sure the patient has 4 of 4 twitches. Turn off volatile anesthetic. Increase FiO2 to 100% and turn up flows to 15 liters per minute. Administer appropriate dose of neostigmine and glycopyrrolate for paralytic reversal based on the patient's weight and the number of twitches seen. Recheck twitches to make sure the patient has 4 of 4 twitches. Look at the ventilator monitor. Make sure the patient is pulling adequate tidal volumes. The patient should be pulling volumes of 4 to 6 milliliters per kilogram. The patient should also have normal peak pressures and normal end-tidal CO2. Suction the patient's mouth, remove the bits, and remove tape from eyes. If the patient is opening their eyes, able to squeeze your hand, or hold their head off the bed for greater than 5 seconds, they are ready for extubation. If patient's breathing well on their own, decrease the pressure support to 5 and switch to bag. At this time, make sure your APL valve is fully open. Loosen the tape around the endotracheal tube if the patient meets extubation criteria. Deflate the cup. Close the APL valve to 30, and on expiration, pull the tube along with the bite block, temp-probe, and OG if one is placed. Open the APL valve, place the face mask on the patient, and make sure they are adequately exchanging air before placing the simple face mask. This can be confirmed with positive end-tidal CO2 on the monitor. Place the simple face mask on the patient at 6 liters per minute. Ensure adequate ventilation and prepare for transfer to the PACU. This concludes the extubation video.